Today I want to talk about infection yesibeleko, or it's also called lower abdominal pain. It affects women who are sexually active. So what is it? Lower abdominal pain. It's the pain that you get below the navel, below the umbilical, no, the navel. You get it below the navel. It just sits there, you know, just above your groin. Yeah, and it's excruciating and it's painful, you know. Sometimes it can even be painful when you pee, for some people. So that is lower abdominal pain. That is where the womb is at, the uterus. That's where it sits, okay? So if you have pain in that area, it means that there is infection in that area, okay? So it is caused by two organisms in most cases, okay? By either gonorrhea or chlamydia. So what tests do we do when you come? We have to do a urine dipstick to check for protein, leukocytes. Leukocytes is a sign of infection. Protein is a sign that there could be leakage. There could be a problem with your kidneys. And then we also check for blood, if there is blood. For instance, in a lot of women, you will find that they are not even in their menstrual period. They're not having their menstrual periods, but gazi, there is blood in their urine. And then what else do we check in the urine dipsticks? And then we also do a pregnancy test, because we need to make sure that it's not a sign of pregnancy, because also when you are pregnant, you also get that lower abdominal pain. And also we need to make sure that in case this person is pregnant, it's not a sign of a miscarriage that wants to happen or is happening. All right. And in the case of someone who committed an abortion, which is termination of pregnancy, we want to make sure that they're not having complications. So we do dipsticks, urine dipstick, we do a pregnancy test, and then we will check your temperature, because we want to make sure you don't have fever. In case you have fever, because we want to know if you are critically ill or not. All right, so those are the tests that we do. How do you get infection yesibeleko, or how do you get lower abdominal pain infection, which is an infection of the womb? In most cases, you get it through sex, okay? 99%. It's through sex, unprotected sex, okay? When I say unprotected, I mean without a condom. That is how you get it. The thing is, basically with sexual infections, they just circulate. They circulate. One person gives another, the one person will give others, and that one. It's like a web, you know. If you are someone who has ever watched Soul City, you will know what I'm talking about. There was an ad of Soul City whereby this one person is seeing two people, and these two people are seeing three people, and then it's like a web. So even with STIs, with sexual transmitted infections, it's the same things. So you get it through sex, okay? What is the treatment? Before we get to treatment, let me first say prevent it. How do you prevent it? Use a condom. Especially if you know or you are suspicious that your partner could also be seeing some other people. If you know your partner is not seeing other people, that's different. But if you don't know much about your partner, maybe it's a one-night stand, or maybe it's you're a side chick, you know, you're not the main meal, you're not the main. So just use a condom, okay? And then the second thing is to limit your partners. Limit your sexual partners as much as you can, because the more sexual partners you have, the more at the risk of getting STIs you are. This applies to both females and males. Okay. What is the treatment? The treatment, remember I said it is caused by possibly by two organisms, gonorrhea and chlamydia. So we treat gonorrhea and chlamydia, or chlamydia. We actually do a syndromic treatment. What is a syndromic treatment? We treat many organisms. We look at your signs and symptoms, and then we look at all the organisms that could cause the infection, and then we just treat you like an umbrella. We give you a treatment of all the possible organisms that could be causing your signs and symptoms. All right. So in this case, you will get ceftriaxone injection. You will get an azithromycin tablet, 2 tablets, 1 gram. It must be 1 gram. Unless you are someone who has a penicillin allergy, it will be 2 grams. But because we do syndromic treatment, okay, we also add Flagyl or metronidazole. Okay, Flagyl covers Trichomonas vaginalis, but we give it to you anyway. Okay, so that is the treatment. For lower abdominal pain, the Flagyl is usually 7 days. Okay, I'm saying usually because practitioners do their own thing. Some people will give it to you for 2 weeks, some people will give it to you for, I don't know, but it's supposed to be 400 milligrams of metronidazole 12 hourly, which means twice a day for 7 days. And then the azithromycin is 2 tablets, or it's 1 gram. Stat, meaning you drink it and finish it at that moment. And the ceftriaxone is 250 milligrams intramuscular in the muscle. Stat as well, meaning at that moment, that's it, you're not going to get it again. The treatment that you will get, it takes 7 days to work. So if after 7 days you still feel that you still have that lower abdominal pain, please go back to the clinic or your clinical provider, so that they can follow it up. Now, what is most important is that your partner must be treated as well, because this is a sexually transmitted infection. Your partner must be treated as well. Guys, I know males are very stubborn because I'm saying it from experience, guys. I've seen patients. I've been a nurse for more than a decade, almost 13 years now. The women will always keep coming back with this lower abdominal pain, and you keep asking, did your partner get treated? No, sister, he refuses to come to the clinic. No, sister, this, no, sister, that. And then it's like, you poor woman, you keep coming back with this infection, and your man doesn't want to come to the clinic. This is not fair. You know, it's not fair. It's not fair. So that is infection yesibeleko. It's also called, medically we call it lower abdominal pain. And if you have any questions, you can inbox me, or you can WhatsApp, or you can just send a comment on the comment section. All right.